Hi, hello, namaskara. Welcome back to Co-Corner. In continuation to the podcast that we had regarding the risk factors involved in having diabetes, cholesterol, and also habits not conducive for good health, we're going to be continuing with yet another two topics which are important to be taken care of. One, hypertension, and another, obesity. We have with us Dr. Rahul Rao K, cardiac surgeon from Narayan Hrudyalaya, who's going to be talking about the risk factors and how to handle the same with a little bit of lifestyle changes and also whatever needs to be taken care of from the medical intervention point of view. So let's welcome Dr. Rahul Rao K, cardiac surgeon from Narayan Hrudyalaya. Welcome back, Dr. Rahul sir. ನಿಮಗೆ ಸರ್ ಹೇಳ್ದ ಡಾಕ್ಟರ್ ಹೇಳ್ದ ರಾಹುಲ್ ಹೇಳ್ದ ಇದ್ದಿದ್ದು ನನಗೆ ದೊಡ್ಡ ಕನ್ಫ್ಯೂಷನ್ ಆ್ಯಕ್ಚುಲಿ ನೋಡಿದ್ರೆ ಅಷ್ಟು ಪುಟ್ಟದಾಗಿದ್ದೀರಾ ಯು ಡೋಂಟ್ ಸೀಮ್ ಲೈಕ್ ನಾವೆಲ್ಲ ನೋಡಿದ್ದು ಆ ಸೀರಿಯಸ್ ಡಾಕ್ಟರ್ಸ್ ಥರ. ಸೊ ಇನ್ ಕಂಟಿನ್ಯೂಯೇಷನ್ ಟು ದ ಪಾಡ್ಕಾಸ್ಟ್ ದಟ್ ವಿ ಹ್ಯಾಡ್ ರಿಗಾರ್ಡಿಂಗ್ ದ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ವಿಚ್ ಆರ್ ಅಸೋಸಿಯೇಟೆಡ್ ವಿತ್ ಡಯಾಬಿಟೀಸ್ ಮತ್ತು other consumptions, external consumptions. Today we're going to be delving about two other important topics that you said are to be discussed. One is hypertension and obesity. So first hypertension ತಗೊಳ್ಳೋದಿದ್ರೆ, what is hypertension in your definition of medical books? Because most often it is referred to as a silent killer because ಅದನ್ನು ಅಡ್ರೆಸ್ ಮಾಡಿಲ್ಲ ಅಂತಂದರೆ it can lead to serious issues ಅಂತಲೂ ಗೊತ್ತಿರೋದಿದೆ. So we'll begin with the basic definition.
Yeah. First of all, thank you for having me again here. This is a continuation of the previous podcast. Continuation in the sense we are basically dealing with diseases which are right now prevalent, and we have covered diabetes and cholesterol in the previous video. Today we'll be talking about yet another important disease, that is hypertension. So being a heart surgeon, why am I talking about all this? Because all these are the three deadly diseases right now which is there in the community, not being picked up. I'll give you a small story which is a real life scenario which we come across recently. I get a call, somebody known to me has a stroke. And the common story would be somewhere in the mid-50s, and this person suddenly felt some tingling, numbness, weakness in the hand, one side. When going to the doctor, blood pressure is high. So if you ask him, he's like, I have been absolutely healthy all my life. So again, that word healthy is very, very relative. So the next question I ask is, have you ever checked your blood pressure in the past? No. So a simple test of just, checking your blood pressure, going to a clinic, even that, you don't even have to go to a clinic. In today's world, you have automatic machines.
Correct.
Machine ತೆಗೊಂಡ್ರೆ ಮನೇಲಿ ಇಟ್ಕೊಂಡು ಚೆಕ್ ಮಾಡ್ಬೋದು. I am not saying they are 100% reliable, but there will be a very small difference between the BP machine what you check at home and in the clinic. So it will definitely give you an idea how your blood pressure is. That was not done. So even if you consider that you are having a healthy lifestyle, and unless you check your blood pressure, you won't know. So that is why he developed the stroke. So that is exactly why you said the word silent killer. So silent killer. So that means for all this time, ಗೊತ್ತಿರಲಿಲ್ಲ that he is having blood pressure or he is having diabetes. So, and the first instance where he came to know clinically is with the complication. So in this case, he's had a stroke. Somebody else would have had a heart attack. Somebody else would have had something else. There are so many other problems. So now in the medical, what is the medical definition of hypertension? Basically, there are various classifications. I am not going to go into it because the JNC classification changes over time depending upon how they actually go through surveys and the population across different parts of the world, and then they do their classification. But a simple way to know what is hypertension is anytime your blood pressure reading is more than 140/90. Correct? Again, this is not a blanket rule. ಸೊ ನಾವು ಕನ್ಸಿಡರ್ ಯು ಹ್ಯಾವ್ ಸಮ್ ಫೀವರ್ ಆರ್ ನಿಮಗೆ ಹುಷಾರಿಲ್ಲ, ನೀವು ಚೆಕ್ ಮಾಡ್ತೀರಾ, ದಟ್ ಟೈಮ್ your blood pressure might look high. So your hypertension diagnosis is not based on a single reading. So please don't get worried suddenly that if you have one high reading, that are you hypertensive? Maybe not, but it definitely warrants that you have to check your blood pressure again. Maybe after a couple of weeks, repeat it, or a month, and do multiple readings. And then if your blood pressure is high, then it needs to be addressed. Okay. There's another point in this, something called as white coat hypertension.
What is it?
White coat hypertension.
Okay.
ಅಂದರೆ ನೀವು ಕ್ಲಿನಿಕ್ಗೆ ಹೋಗ್ತೀರಾ, you will go to the doctor, you will get worried seeing him, you check your blood pressure, it shows high.
Arey va.
So this is very common. Like we did a camp a month back again. So we went there, and at least about 3 out of 10 people whom we checked who had high blood pressure, we told them go back home, use your machine at home, and check and let us know. So every time we checked in the camp, the BP was high. But when we checked it at home, when they checked it, it was turning out to be normal. So that is a small percentage where the BP can, vary. But otherwise, if your BP is high, recheck it, and if it is persistently above 140/90, it needs to be addressed. Now, addressed andre enu, you have to go back to your doctor and ask him what needs to be done. So the next point is what needs to be done.
Basically, ಇದಕ್ಕೆ if we have to know, what could be the causes, simple ones. We may not be able to find out, if there is anything really complicated, but, simple reasons ಯಾತಕ್ ಬರ್ಬೋದು ಇದು ಅಂತ ತಿಳ್ಕೊಳ್ಳೋದಿದ್ರೆ.
ಸೊ ಬೇಸಿಕಲಿ ಯಾರಿಗಾದರೂ ಹೈಪರ್ ಟೆನ್ಷನ್ ಅಂತ ಡಯಾಗ್ನೋಸಿಸ್ ಬಂದರೆ, ಸೊ ಮೇ ಬಿ ಯು ವುಡ್ ಹ್ಯಾವ್ ಗಾನ್ ಟು ಯುವರ್ ಡಾಕ್ಟರ್ ಆರ್ ಯು ವುಡ್ ಹ್ಯಾವ್ ಡನ್ ಯುವರ್ ಓನ್ ರೀಡಿಂಗ್ಸ್ ಎಟ್ ಹೋಮ್. The evaluation, so we'll have to investigate, like what you said, what are the reasons why somebody would develop hypertension. Most commonly it is something called as essential hypertension. There is nothing essential in it, but you develop hypertension without any obvious cause. But there are definitely contributing factors. So the most common thing is tobacco use.
Again.
So the unfortunate part is a lot of things are related to our lifestyle. So tobacco use in any form. So the tobacco use in any form is very important, any form, because the moment I say stop tobacco as cigarette, they will go to electronic cigarettes, and that keeps changing. So that a smoker will try to use different ways to justify what he does. So any form of tobacco can increase your blood pressure. So it's very well documented. New tobacco consumption stop ಮಾಡಿದ್ರೆ, there is a definite chance that your BP readings may not come to completely normal, but it will definitely come to a lower level than with tobacco. Other thing is age related factors. Definitely as you grow older, there is a chance that you might develop hypertension. Family history is again very, very important.
Okay.
If your parents have had hypertension, especially at little younger age, you have an increased predilection to develop hypertension. The other point is the secondary hypertension, what we call, that is usually happens in the younger age group. So avaga, go to your doctor, he might ask you for some tests to see is there any other endocrine causes which is contributing to your hypertension. So there are so many conditions. A few tests will help you to find out if that is contributing to your hypertension. People who are young and who are developing hypertension with no obvious cause ideally should get evaluated so that these factors are ruled out, and then it can be treated either with, ideally with medicines if required.
Seems like, we have ignored quite a few things ಅಲ್ವಾ on a normal day to day basis ಅಲ್ಲಿ ನಮ್ಗೇನೋ ಒಂದು ಸಣ್ಣ ಪುಟ್ಟ ಚೇಂಜಸ್ ಆದರೆ ವಿ ಆಲ್ವೇಸ್ ಐ ಥಿಂಕ್ ಅಟ್ರಿಬ್ಯೂಟ್ ಇಟ್ ಓಕೆ ಇವತ್ತೇನೋ ಮೋಸ್ಟ್ಲಿ ಸ್ವಲ್ಪ ಕೆಲಸ ಜಾಸ್ತಿ ಆಗಿತ್ತೇನೋ ಅದಕ್ಕೋಸ್ಕರ, ಅಥವಾ ಏನೋ ಒಂದು ರೀಸನ್ ತೊಗೊಂಡು ಒಟ್ನಲ್ಲಿ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಲ್ಲ. ಸೊ ಇಫ್ ವಿ ಹ್ಯಾವ್ ಟು ರಿಯಲಿ take care of all these things, how do you start off with the lifestyle changes? ಇವಾಗ ಹೈಪರ್ ಟೆನ್ಷನ್ ಇದೆ ಅಂತ ಡಯಾಗ್ನೋಸಿಸ್ ಆಗಿದೆ, ಬಟ್ ಅದರೊಳಗೆ ಏನಾನ ಒಂದು ಸಣ್ಣ ಪುಟ್ಟ ಚೇಂಜಸ್ ಮಾಡಿಕೊಂಡು ಅದನ್ನು ಕಂಟ್ರೋಲಿಗೆ ತರ್ಬೋದು ಅಂತಿದ್ರೆ, ವಾಟ್ ಕುಡ್ ಬಿ ದೋಸ್ ರೀಸನ್ಸ್ ದಟ್ ಯು ವುಡ್ advise or suggest, doctor?
Yeah, so this is not a blanket statement,
Yeah.
but generally, if you again, I'm going back to the three diseases: diabetes, cholesterol, and hypertension. If you consider these three diseases, diabetes probably can be controlled with only diet and exercise if the person is very, very vigilant, very disciplined in his lifestyle.
I've also, sorry to interrupt, but I've also heard that, a little bit of rest, sleep, timely sleep will help, in controlling. ಅದು ಒಂದು ಕಂಟ್ರೋಲಿಗೆ ತರಬೇಕು ಅಂತಂದರೆ ample rest is also advised, is what I have at least heard.
Yes, inadequate sleep.
So sleep also is...
Yes, inadequate sleep, lot of stress levels, lack of exercise. You don't have, a lot of, basic usual life, day-to-day tensions in life. If you take it too much to the head and there's a lot of stressful situations, definitely that is a contributing factor to you having high blood pressure. So
how does it affect the heart if you have, high BP?
So
iddaga, what are the risk factors that are involved?
Yeah, so it's the same.
Especially because you're a cardiac surgeon, I'm coming to that, specifically to that organ.
So it is the same trio which is, goes together and causes an organ damage. So if you talk about the heart, you have an increased propensity to develop heart attacks, meaning you will have blockages in the heart. Also something called as heart failure. Heart failure andre when the BP goes extremely high, you can have a normally functioning heart, but because of the extreme levels of the blood pressure, the patient goes into something called as an accelerated hypertension or a hypertensive urgency or an emergency. They can develop a situation called as pulmonary edema, diastolic heart failure. Andre, the heart is not able to cope up with that high pressure, and there will be fluid accumulation in the lungs, and that is the heart fails in the medical term, but not in the general term. So once you control the blood pressure well, the heart kind of may recover. So that is a problem. So these are the two important organ damages that happens particularly in the heart because of blood pressure. But my concern also is of the brain, even though that is not my specialty.
I know.
Because hypertension if you ask
I know of a friend, who actually had a stroke. In fact, we were just in a program and no history of anything, because
not checked.
as usual we have not checked, on a timely basis, on an annual basis, ಚೆಕ್ ಮಾಡಿಸಲಿಕ್ಕಿಲ್ಲ. ಸೊ ಆ ಪ್ರೋಗ್ರಾಮಲ್ಲಿ we were just having a good time, and then suddenly one person collapsed. Why ಅಂತ ಗೊತ್ತಾದಾಗ ಸ್ಟ್ರೋಕ್ ಆಗಿತ್ತು, and then immediately he was rushed to the hospital to see that his BP was so high and that really affected his brain.
Yes. So if you ask any neurospecialist, either a neurosurgeon or a neurologist, they will probably give you a better idea about how much is the organ damaging effects of hypertension on the brain. So that is a simple thing of controlling blood pressure will avoid so many problems in your life. So you just have to check your blood pressure maybe once in a month, make sure it's normal. If it is not normal, then address it.
So address antanga medication and also lifestyle change.
Yes. So
what are the best practices, if you
correct.
want
so
to say?
Best practices, like I said, hypertension at some stage will usually need medications. I am not making it a blanket rule, but usually. Whereas, like I said, diabetes, probably you can control it with diet and exercise. Or if you are very disciplined in your diet and exercise, probably the dose of medication requirement for diabetes becomes very, very less. Hypertension, definitely if you stop your tobacco use, obesity is a very important contributing factor. Your lifestyle where you have absolutely no physical activity. In fact, I think just a couple of days back there was a study which showed that the physical activity of Indians is very, very low. And even though it's Western data, I am I kind of agree with that because it's very obvious to all of us the amount of exercise we have, all of us. ಇವಾಗ ಮನೆಯಿಂದ ಅಂಗಡಿ ಹೋಗ್ಬೇಕಾದ್ರೆ ವಿಲ್ ಟೇಕ್ ಅ ಕಾರ್ ಆ್ಯಂಡ್ ಗೋ. 20 years back we would take the same, we would walk and go to the shop, buy something and come back. Or now you have apps, you just order everything. So, and we will make all reasons to use a vehicle to go somewhere rather than take a simple walk and come back and do the job. So definitely physical activity definitely helps in controlling your blood pressure. Weight reduction helps.
ಇನ್ಫ್ಯಾಕ್ಟ್ ಇದು ಎಷ್ಟು ಇಂಪಾರ್ಟೆಂಟ್ ಅನ್ನೋದಕ್ಕೆ ಫಿಸಿಕಲ್ ಆ್ಯಕ್ಟಿವಿಟಿ ವೆನ್ ಎವ್ರಿ ಅದರ್ ಡಾಕ್ಟರ್ ಇಸ್ ಇಂಪ್ರೆಸಿಂಗ್ ಅಪಾನ್ ಹೌ ಇಂಪಾರ್ಟೆಂಟ್ ಇಸ್ ಅ ಫಿಸಿಕಲ್ ಆ್ಯಕ್ಟಿವಿಟಿ. ಸಮ್ಟೈಮ್ಸ್ ಐ ಫೀಲ್ ನಮ್ಮ ಗವರ್ಮೆಂಟ್ ಕೂಡ ಒಂದು ಸ್ವಲ್ಪ ಕಿವಿ ತೆಗೆದು ಕಣ್ಣು ತೆಗೆದು ಕೇಳಿಸ್ಕೊಂಡು ಪ್ರೊವೈಡ್ ಗುಡ್ ರೋಡ್ಸ್ ಫಾರ್ ಅಸ್ ಟು ಜಸ್ಟ್ ಸ್ಟೆಪ್ ಔಟ್ ಆ್ಯಂಡ್ ವಾಕ್. It is an issue, honestly to speak. If we can do it, I'm not saying we won't do it. We can hit the gym, there are parks, everything is fine, but make it user friendly for every category, so that you just step. Why foreign andre other countries alli they are able to indulge in those kind of physical activities? Shoe ಹಾಕೊಂಡ್ರೆ ಎಲ್ಲೂ ಎಡೋದಿರ ಹೋಗಿ ಸೇಫ್ ಆಗಿ ಮನೆಗೆ ಬರ್ತೀವಿ.
Even say 15 minutes, this is not a number, I'm just putting it just for the sake of discussion. 15 to 20 minutes of walking every day is helpful in not only your hypertension, even in your weight reduction, in your diabetes, cholesterol, your overall health.
Correct.
There is a caveat to this. Now, if you are extremely obese, this is something which was brought up and told to me by one of the nutritionists, which was a very valid point. If you are extremely obese, you should ideally avoid walking, in the sense weight bearing exercises can have an effect on your knees. So I'm not saying don't exercise. What you need to do is you need to reduce your weight so that your body weight doesn't have that pressure on your knees and your lower body, because human beings are the only animals in the animal kingdom who stand erect. So your central column, it has effect on your knees and your ankle and your feet. So if your upper body weight is very more than your lower body, then you have a problem. But apart from that, generally, as a general rule, walking is very, very helpful. You start somewhere, at least you start walking every day, make it a routine. And once you do it a routine, you will do it every day. That itself helps a lot. All other forms of exercises, even a simple yoga, the
ಫುಡ್ ಹ್ಯಾಬಿಟ್ಸ್ ಬಗ್ಗೆ ಬರಬೇಕು ಅಂತಂದ್ರೆ,
yeah. So common thing what you would hear is uppu kadime ಮಾಡಿ, and true, it helps you in controlling your blood pressure in your very early stages. But if you are an established hypertensive for other reasons, probably because of age or family history, probably it may not help that much, and your more focus should be on exercise and also taking medications. So I'm not saying that uppu you keep hoarding yourself, not that, but probably especially in the elderly, what happens is elderly hypertensives, ನೀವು ಉಪ್ಪು ಕಡಿಮೆ ಮಾಡಿದರೆ they will have another set of problems called as hyponatremia, where their sodium levels comes down. So extra added salt, definitely not advisable, but the general salt what we add in the diet probably may not be that harmful. Especially in an established hypertension. Early stages of hypertension, yes, controlling salt may help you, but ultimately you will need medications for hypertension at some stage. So please don't shy away from taking medications, because you are actually looking at a situation where you being not compliant, illa nange medicine bad ant kutkondre, in a few years time you will have a problem which may unfortunately sometimes be irreversible. Like the person who's had a stroke, many people may recover, but a lot of people will have irreversible changes. Andre weakness irutte, they can't walk, some people, all those things are there. So these are very easily avoidable problems if you are very vigilant and you keep checking your blood pressure and you keep it under control. So what is the meaning of control? It has to be less than at least 140/90. So I'm not giving you exact numbers again, because your treating doctor is the best judge for your clinical situation to tell you what is the number you have to rely on. There's another point I just want to add. There will be situations, ಕೆಲವೊಮ್ಮೆ you will see a prescription, patient ಬಂದು ಹೇಳ್ತಾರೆ, ನನಗೆ ಈ ಮೆಡಿಸಿನ್ಸ್ ಎಲ್ಲ ಬರೆದಿದ್ದಾರೆ ಬಟ್ ನನಗೆ ಬಿ ಪಿ ಇಲ್ಲ. So, but, so what is the answer to that? So the answer to that is, there are certain situations where there are BP medications which have multiple effects and multiple roles. So especially in diabetics, physicians would start a medicine which is actually for blood pressure, but it is protective for your heart and vascular health. So please don't stop those medicines because somebody else will tell you, idu BP medicine, nimge BP ilwala, yake start madidare. So those low dose medicines actually help you in your vascular health. So again, bottom line, when you are consulting your physician or your doctor, regular doctor, please follow his instructions and keep a follow up with him. And in most instances, his word should be the final word, because he knows your situation best.
So, how often do you recommend any patient or anybody for that matter to undergo these kind of checkups to find out, ಅಂದ್ರೆ once in 6 months ಅಥವಾ
Blood pressure checking, probably
1 month ಅಥವಾ
probably in a month if you check, it's an ideal situation. So how do you check it? Not that you have a jog and come and then check your blood pressure. It doesn't work, because your blood pressure will definitely be high. You've not had adequate sleep, you've had a high stressful situation, your blood pressure will be high. Ideally, lie down for about 20 minutes, and once you are relaxed, check your blood pressure. If it is persistently high, then you will either, if you are already on medications, you will need adjustment of the medications. If you are not on medications and if your doctor feels that you need to start medication, please start medication.
Doctor, if we have to really talk about controlling the hypertension, do you suggest meditation and yoga? Because ತುಂಬ ಜನ ಹೇಳ್ತಾರಲ್ಲ ಅದು ಕಾಮಿಂಗ್ ಎಫೆಕ್ಟ್ ಇರುತ್ತೆ ಅಂತ. ಸೊ ಅದರಿಂದ ಕೇಳ್ತಾ ಇದ್ದೀನಿ. ಅಫ್ಕೋರ್ಸ್ ಕೆಲವ್ರು ಹೇಳ್ತಾರೆ ಪ್ರಾಣಾಯಾಮ ಮಾಡ್ತಾರಲ್ಲ, ಒಂದಷ್ಟು ಪ್ರಾಣಾಯಾಮ ವಿಲ್ ಆ್ಯಕ್ಚುಲಿ ಇನ್ಕ್ರೀಸ್ ದ ಬಿ ಪಿ ಅಂತಲೂ ಇದೆ.
Yes.
ಸೊ ದೆರ್ ಇಸ್ ಅ ಕನ್ಫ್ಯೂಷನ್ ಇನ್ ದ general public as to what's to be followed, what's not to be followed anta.
Meditation definitely helps you.
Yeah.
But what you need to understand is, it is not the sole therapy. You can't just do meditation and say that I will control my blood pressure. On top of my head, I don't remember the studies, but there are definite literature which suggests that about 5 millimeter of mercury drop in blood pressure or more is recorded in people who are regular with their meditation and yoga. It is there in the papers now. It is gone are the days where allopaths would completely refute these things. Now there is a lot of integrated therapy, what we call. So even in our hospital, after heart surgery, there is a yoga instructor who will come and teach them yoga. The primary reason is because there is definitely evidence that it helps. But the problem with people is they just rely on only that. You can't do that. If you have hypertension, meditation definitely helps. Like you said, there are certain exercises in yoga I have not specialized in, but there are certain situations where...
I'm not getting that name.
Things, yes, those exercises probably may not be advocated for established hypertensives where their blood pressure is not under control. So that has to be done with the monitoring of your yoga instructor or your doctor, and then
I think they both need to be consulted before you
Yes, but
design a
definitely
program for such people.
Meditation definitely helps. It calms your body, calms your mind. Definitely helps not only your blood pressure, all your body systems. And at the end of it, there's definitely no harm in sitting quiet for 20 minutes. You're become less menace to the society, and you're isolating us.
Very well
on a lighter note. But that's the good thing about meditation.
Correct. Thank you so much, doctor. So now I think by and large, I think we covered the things that we wanted to discuss about this hypertension. But if we have to now move on to obesity,
Yes.
ನನಗೆ ಗೊತ್ತು, I have no right to really sit and discuss about it.
It's a very sensitive topic.
Very sensitive topic. What could be the reasons for this obesity? ಈಗಂತೂ ತುಂಬ ಜಾಸ್ತಿನೇ ಆಗಿದೆ.
It's
So
basically
what
life.
is obesity first, and then what could be the reasons for this obesity?
Again, I am not going to get into the definitions
Yes.
because I have no right to talk about
ಯಾಕಂದ್ರೆ
definitions.
ಯಾತಕ್ಕೆ ನಾ ಕೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂತಂದ್ರೆ, ಕೆಲವು ಸತಿ ಹೇಳ್ತಾರೆ ಇಟ್ ಆಲ್ಸೋ ಗೋಸ್ ಬೈ ದ ಫ್ಯಾಮಿಲಿ ಹೆರಿಡಿಟ್ರಿ.
ಫೆಮಿಲಿಯಲ್ ಕಾಂಪೊನೆಂಟ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಅಂದರೆ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ your body constitution is half of it is determined by in your familial how your family is. You can't deny that. That's true. But today's world of what we see, obesity, is clearly there's a large lifestyle component. The kind of food we eat, the kind of physical inactivity that is looming around. Half of us don't exercise at all. Even as children, if you consider when we were children, the amount of play we had was
Correct.
different, and now it is in between. It was not there. Of course, now a lot of things are changing even in schools because they are actively introducing and implementing that the child has enough play time. So
Correct.
that's a welcome change what we are seeing.
Yeah.
But the obesity what we are seeing is definitely related to the food what we eat. Lot of processed food, high carbs and unnecessary junk food. No physical activity is definitely a contributing factor to the obesity. So what is obesity? Again, it goes on the BMI indicators and there are a lot of indicators which will tell you whether you are obese or not. So the BMI generally tells you the BMI generally tells you who is obese or not. So generally if a BMI is more than 25, that generally puts the person into an obese category. The other simple thing is you yourself can see your weight just going up, shooting up over the last 4-5 years, and it is staying there or it's still becoming worse. ಅದರಲ್ಲೇ ನಿಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ. So that you can't blame it on your family. So there's definitely that component. So you have to address it if that is happening. There are again two components to it. Obesity can be a medical condition. There are certain medical disorders which contribute to you putting on weight. So go to your doctor, get yourself evaluated. Is there a medical problem which is causing you to put on weight? If it is not there, then once you rule it out, then you start addressing it to see that your weight comes down and you become more healthier.
So what are the things that you would suggest? Okay, ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ತಾರೆ, ಅದಾದ್ಮೇಲಿಂದ would you as a heart surgeon, because you might also have cases ಎಲ್ಲ with the history of obesity that
Yes.
can affect the heart as an organ. ಸೊ ಅಂಥವರಿಗೆ ನೀವೇನು ಹೇಳಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀರಾ?
So basically we have to do what our ancestors used to do. It's in a very simple word. Be more active. Be very careful with what you eat. So there are so many diets which people would want to follow. The most common problem what we see is once you are obese, you try to drastically reduce your weight, listening to a lot of things which come on social media or whatever, lose your weight in so many days and all that. What you need to know is a large part of your body is made of water. So most of these crash diets, what they promise you that you lose your weight, is actually you lose water. So if you want to lose your weight, there is a scientific way of doing it. You have to do it consistently, slowly, probably a couple of kgs, not more than that, in a month or so. And it is a 1-year plan. It is not a 30-day plan. The reason why I say that is when you do it as a slow process, it stays like that. When you do it as a fast-paced activity in 1 month, you might have significant weight loss and you are happy in a month. In the next 3 months, you are back to where you were before you did that. So how do you control your weight and reduce your weight? Have a very good daily routine. Exercise every day. The exercise has to be graded. That means to say, what is the meaning of graded? If you have not been exercising at all, you can't hit the gym straight away because it doesn't help you. You do routine exercises slowly, like walking, brisk walking. Do it for a month, then continue and increase the activity. So from walking, you can probably do brisk walking, then go for jogging. Or if you have a professional trainer who can help you with it, that is good. The only grouse I have with going to a gym is I have absolutely nothing against a gym. The problem ಏನಾಗುತ್ತೆ you have to do something which is sustainable. You have to think whether it is possible for you to go to gym for the rest of your life or not. If you are mentally ready to do it at least 4 days in a week for the rest of your life, then it is good for you. But for me, I would say that doing something at home, even a yoga and then go for a jog, is much more practically possible for you to do for a prolonged period of time. And that consistency will help you in becoming more physically active, and over time your weight also will come down and you will become healthier.
So, what is the direct relation of obesity that affects the heart?
So, unfortunately, all these things are interlinked. So, most of the time, obese person will tend to have diabetes. Again, not like definitely that if he's obese, he'll definitely have diabetes, but they tend to have diabetes, they tend to have cholesterol problems, they tend to have hypertension. So, all these four things put together increases your risk of developing heart disease. So, if you add tobacco to that, that is like a extra, synergy. So, it definitely increases your risk maybe fivefold. So, the reason why so much of emphasis and focus on obesity now is because the moment you control your weight, your diabetes also comes under control. I'm not saying your medications can be completely stopped, but definitely the amount of dose of medication, the number of medications, everything can come down if you are very, very disciplined in your exercise and diet. And there is another downside to it, which I also wanted to bring about. So, just because somebody is lean doesn't mean that they are healthy compared to an obese person. I'm not trying to put down lean people, but that's a fact. In today's world, just because you are thin and lean and whatever, and you're going to the gym regularly, doesn't just make you fit. Your fitness is not determined by how you feel. You have to get yourself tested because there are so many risk factors which might put you at risk of not only heart disease, brain and everything. That is why you hear stories where Chanagida Jim Goda collapsed, simply because he has not tested himself. So you have to test and then you can be sure that you are healthy. So obesity is definitely a contributing factor to disease. But just because you are not obese doesn't mean that you are immune from these lifestyle diseases.
So, if we have to really wind up about these two crucial things that we were discussing, hypertension and obesity, what is the connection these two have on the heart?
So again, it's the
It's
same
the
thing.
same thing.
Yes, once when you start putting on weight, the risk of developing hypertension, diabetes, cholesterol increases. So the moment your weight comes down slowly, all these also tend to slowly come down to, if not normal levels, but lower levels than when you were obese. So there's a direct relation, definitely, and controlling obesity goes a long way to controlling all these diseases for you.
So, what are the final tips that you want to give finally as we end this session of talking about hypertension and obesity? Timely checks.
Yes, timely checks, go to your doctor, keep a follow up, and if you're talking about lifestyle changes, you need to have a regular routine where definitely you need to have exercise. Okay, you need to have some regular exercise, whichever you prefer to do, but you need to do it on a regular basis, at least if not daily, at least 5 times a week. You need to have the discipline. Also, in your diet, don't go for crash diets. It definitely doesn't help. One of my teachers, my mentor, cardiology professors from St. John's, Dr. Kiran, says the best diet to follow is called as the ELF diet.
What is elf diet?
It's eat less food. I mean, this is something he told in one of the radio shows, and it stuck in my head from then on. He's a very nice gentleman. It's a very, very sound advice, because most of the other diets which are useful, but again, it is not sustainable. You can't do it for the rest of your life. But eating less food and increasing vegetable intake, this definitely helps you in cutting down your calories and helping you control all these diseases.
Super. Thank you so much, doctor, for this time, and then, for that continuity that we had to actually finish with. And I think now we have covered majorly all those factors that attribute to, having good heart, and also how to take care of our heart. Thank you for your time.
Thank you so much. Thank you for having me here again. So, looking forward to one more session probably.
Yes.